This is the third, final, and maybe the most important part of the pain education presentation. In part 3, you will learn how to better understand the contributing factors involved in your personal pain experience and what kind of plan needs to be developed to properly target those contributing factors and effectively address chronic pain. That being said, keep in mind that the information taught in parts 1 and 2 are vital and form the foundation upon which that plan is built. If for some reason you skipped parts 1 and 2, please watch them now and then return to part 3. To develop an effective treatment plan to address chronic pain, both you and the providers involved in your care must have an accurate understanding of the multiple contributing factors involved in your pain. These contributing factors can be organized into 3 categories. By thinking of your pain in this way, it will help you to understand which factors are best targeted by medical treatments and passive modalities, and which ones require your active engagement to address. There may be underlying or originating sources of nociception or irritable signals coming from the tissues of the body. Sometimes specific medical interventions can turn these faucets down. But most people, even ones that don't experience pain, have a few sources of nociception that do not go away. But don't worry, these faucets of irritable signal are often only small drops in a really big bucket. If the other contributing factors are managed well, you can still see a lot of improvement. The most important thing to remember is that the pain neural signature is the biggest contributor of all, especially when pain becomes chronic. It's the activity within these areas of the brain that determine how full the tubs are and how easily they overflow to create pain. And when the pain neural signature remains in a threatened state, it affects our endocrine system, our immune system, almost all of our systems. This will cause changes in the tissues of the body, and over time, create new sources of nociception and irritable signal. As I said before, medical treatments can turn down some primary faucets and address many threats to the tissues or issues of concern. Passive modalities can temporarily turn down some faucets too. But if you really want to see long-lasting changes occur, you have to accept some truths about your body. In fact, there are 5 truths that we must acknowledge about how changes actually occur in the body. Lots of times people have been led to believe that their body is like a machine, and when there is a problem, they want to address it like you would a machine. The reality is that every single part of your body is a living thing. This makes us completely different than a machine. For example, if your car makes a sound, you take it to a mechanic. They fix the car, and then the sound goes away. But that's not how it works with living tissues. Let's say you have a plant that hasn't been watered in a month. You can't just give it a month's worth of water all at once and say, I just fixed the plant. With living tissues, things don't just get fixed. Living things adaptively change over time in response to what they're given and what they're exposed to. Let's say you start to water that plant again. You don't see the benefit right away, but if you keep dosing it with what it needs on a regular basis, then over time, you'll see positive changes start to occur. It's important to keep in mind which tissues we are wanting to make changes in. It's good to turn down the primary faucets of irritable signal as much as possible. We also want to make changes in our tissues so those secondary faucets of nociception turn down as well. But we have to keep in mind that if the pain neural signature has learned how to stay in a threatened state, trying to exercise as if the tubs were as empty as they used to be won't really help. It may just make pain worse. When this happens, people often choose not to exercise at all. This is an overdue, underdue, boom-bust cycle that is all too common for people with chronic pain. Positive changes require your engagement in activity and exercise, but how you pace and dose activity is what makes the difference between seeing improvement, nothing happening at all, or things just getting worse. There are 2 paths that lead to more pain and one that leads to an improved quality of life. If you always avoid the barrier, the pain neural signature in the tissues of the body will not be stimulated to adaptively change. Waiting for pain to go away or for all of the primary faucets of nociception to be completely turned off will ensure that no changes will occur. However, if you constantly push through the barrier and continually overflow the tubs, the pain neural signature will learn how to stay in a threatened state, and you will get caught in repeated boom-bust cycles. Properly pacing fun activities, necessary daily activities, and exercise that will improve overall health will stimulate the pain neural signature and the tissues of the body in a way that positive changes will start to occur. Now that you have an accurate understanding of what pain is and why it becomes chronic, you can target the contributing factors in a way that will actually work. Lots of people, and even some healthcare providers, think that medical treatments and passive modalities are where treatment should always begin. But if the pain neural signature stays in a threatened state, behaviors that target secondary faucets or treatments targeting the primary faucets will likely not be effective. This is why a comprehensive approach is so important. There are many resources where you can learn skills that will help. You should start applying them right away to help keep the tubs drained as much as possible. Learning guidelines for proper pacing of activity and exercise will help reduce boom-bust cycles and turn down some of the secondary faucets of nociception. Sometimes you may need support. Maximize any value you can get out of non-pharmacological passive treatments, especially those that you can use on your own and that give you some control. These can help keep you engaged in active independent strategies. Sometimes you will need guidance in implementing behavioral strategies. Behavioral experts like psychologists can help guide you in how to develop skills that address thoughts, mood, behavior, stress, and anxiety. These play a big role in keeping the pain neural signature in a threatened state. As the pain neural signature becomes well managed, real tissue changes start to take place. Your pain experience can greatly improve, even if some of those primary faucets are still left dripping. With the right plan in place, you will start to notice improvement in your ability to return to a more active lifestyle. When you properly pace a balanced exercise program, all sorts of changes start to occur, both in the brain and in the tissues of the body. Tissues become less stiff and tight, your balance, strength, and endurance improve, along with your confidence in your ability to move. Your brain will also start to pump out those wonderful molecules that turn down nociception, endorphins. By properly pacing necessary daily activity, you can get the things done that you need to get done without constant boom-bust cycles. This will reduce the stress, frustration, and even depression of feeling things build up while reducing anxiety caused by anticipating those flare-ups when you push through to get things done. When you pace and dose even small amounts of activity that you find fun, you'll be pleasantly surprised to find that you can start to get back some of the meaning and joy out of life as well. I can't promise that you will be the elite star athlete that I'm sure you once were, but when you accurately target what it is that gives you your joy and work low and slow in that direction, you will find meaning once again. Even though pain may not completely go away, many people who are consistent with a well-balanced plan do state that disruptive flare-ups of pain that have become so overwhelming and seem to interfere with everything start to become less frequent, don't last as long, and are less disruptive. As you implement your plan of care, it's important to remember that change takes time and there will be ups and downs. Living tissues don't just become fixed. Disruptive flare-ups will still come and go. When you do encounter barriers to your progress and experience these ups and downs, it is important to not abandon the path that might actually be taking you somewhere. Sometimes small modifications in how you dose your activity and treatment can make a big difference. This brings us to the most important truth about making changes to the tissues of your body and the pain neural signature. Because you are made of living tissues, because living tissues don't just become fixed, because medications, passive treatments, and procedures do not adequately target many of the contributing factors involved in your pain, because adaptive changes in living tissues require regular dosage of what they need, and because changes occur incrementally over time, you are the most important provider involved in your plan of care. You may need some support from behavioral experts, from exercise experts, or from medical providers and passive treatments, but only you can provide what's needed on a regular enough basis for brain changes and tissue changes to actually occur. When you and your providers understand pain and accurately identify the contributing factors involved, and when you know and acknowledge how to make effective changes in your body, you will be laying down the right foundation on which to build an effective plan of care. You and your providers will be able to develop a plan of care that targets those contributing factors that actually have the greatest impact on your pain. The good thing you will find is that even as you start to drain a few tubs or turn down a few faucets, you will get the leverage that you need to start to control those other contributing factors that remain. You will be able to take control of your pain experience and really improve your quality of life. I hope you've enjoyed this presentation, and I hope you take away a better understanding of what pain is and what can be done about it. Thank you for your time. Thank you for your attention. And most of all, thank you for your service to our country.